Welcome to the Dynamic Radiologist Podcast, where we feature leading experts in healthcare. And now, here's your host, Dr. Stephen Brownstein.
Hello, Dr. Stephen Brownstein here. I am the host of the Dynamic Radiologist Podcast. Through this platform, I have the great honor to interview top leaders in health and in business to discuss what they are doing to change the world. Some of the amazing guests that I have interviewed include Dr. Jeffrey Kronk, CEO of Spinal Kinetics, Smart Injury Doctors, and Smart Injury Lawyers, Dr. Mike Carberry, CEO of Advanced Medical Integration, Dr. Donald DeFabio, and Howard Reese, CEO of the Teledentist. This episode is brought to you by Dynamic Medical Imaging. I started this organization over 16 years ago and have experienced consistent growth and opportunity ever since. We have the only Fonar upright MRI in central and northern New Jersey. We've had patients consistently coming to our center from over 20 miles away. Over 25% of our patients are either claustrophobic or have failed to have their MRIs completed in a closed unit. They have come here to have their studies performed in the Fonar upright MRI. We have had over 3,000 doctors from New York, New Jersey, and Pennsylvania refer their patients to us. What is really telling, though, that these same doctors who referred their family, friends, and patients have come here themselves to have their own studies performed. Please check out our testimonial comments and interviews on our website, www.dynamicmedicalimaging.com, and see for yourself what your fellow patients have said about their great experience at Dynamic Medical Imaging. Our second sponsor today is Spinal Kinetics, a company I started over 10 years ago. We help medical providers of all specialties evaluate for the presence, location, and severity of spinal ligament injuries. If you do stress radiographs in any format, then you can send them to our trained doctors who use our special technology. Spinal Kinetics developed a technology called CRMA, or Computerized Radiographic Mensuration Analysis, which is an advanced X-ray measurement technology to accurately measure the exact abnormal motion problems that occur with a spinal injury ligament. If you have any questions, go to www.thespinalkinetics.com or email us at support@thespinalkinetics.com. Today, I have the great opportunity to interview our resident hero, Tanya Myers. She is our Chief MRI Tech, but more importantly, she's served in the Air Force and also, most importantly, helps tutor, comfort, advise children who've lost their parents in the military. And I couldn't be happier to say she's one of ours. Tanya, welcome.
Thank you so very much.
It's a pleasure. So, what got you into the military, first of all?
At the time, I actually enlisted in the military right after September 11th. So that was a slight inspiration, but I just felt the need to do something different, get away and see what the world had in store. And the military seemed like the best option at the time. So I went for it.
So where did you serve?
I served in Texas at two different locations. One was Shepherd Air Force Base, and the other was Wichita Falls, Texas. I've also served at Wright-Patterson in Ohio. I've been at Bolin Air Force Base, which was the start of my career, and the Air Force Honor Guard, where I got to serve closely to the presidents during my tenure, as well as serving at the Pentagon, and most importantly, giving honors at Arlington National Cemetery by giving families the final view of their loved ones' military service. So those are some of my important bases. I've also served at Andrews Air Force Base in Maryland.
That's awesome. And
Thank you.
so what got you into being an X-ray technologist and MRI technologist?
Great question. While serving in Wright-Patterson, I went to training for X-ray, and then I was stationed at Andrews. Actually, while doing the Air Force Honor Guard, someone mentioned, have you ever done radiology? I was like, no, not really. And we're like, you should look into it. So then about maybe a month later, someone else said the exact same thing. So I thought I should look into it. And as I did, it seemed like a really good option at the time.
You got your initial training in the military, correct?
Yes, sir. Yes, sir. And once I left the military, I got certified civilian side. So I applied, I took the test, and unfortunately, I couldn't get hired. I redid my resume over and over. So when I did get out of the military, I went to my first passion to teach children. So coming to work with you guys here at Dynamic Medical Imaging was my opportunity to get back to the medical field. And I appreciate that.
Well, we appreciate you. You know, it's your personality, your energy just exudes and influences every molecule in the air around us. So we're blessed to have you.
Thank you. I feel exactly the same. It's a great partnership.
No, absolutely. So you expressed, you know, your interest in children, and obviously you kind of blended that with your extension of your time in the military and the trauma and the stress that's created when a family loses one of their members.
Yes, sir.
And you want to tell us a little bit more about the whole program and
Yes.
what you do?
Yes, sir. So the program was actually started by one Bonnie Carroll when she lost her husband in a training incident. And she realized that there was no support system for military families to keep them connected to the military and the civilian side of life. So she organized a program called TAPS, which stands for the Tragedy Assistance Program for Survivors. And what we do, it's a twofold camp. So on one side, you have mentors, i.e. people like myself, who are also military members, and we mentor the children who are going through trauma, who feel like they're alone, who they don't feel like people understand their type of loss. So she organized a camp called Good Grief Camp, which brings kids together who have similar losses. So now not only do you feel reconnected to the military, but you just feel reconnected to people who understand your grief. And on the other side, while we're mentoring the children, the parents, the surviving parents or older siblings are receiving similar trainings on dealing with grief and dealing with their children who are surviving. Because sometimes when you lose someone, it feels very solo. It feels very personal, and you kind of forget that there are other people around you. So our trainings, they have several different trainings. The national training is in May, over Memorial Weekend, of course, and it's over the course of about 4 days. And the magic is you pair up a mental health care person, someone who has done training in grief work, and you pair them with a military member, and you bring this team to these children, and it gives them something to grab to. And the magic that happens, it's almost instant, and it changes your life forever. So I've been a part of the organization for about 18 years now.
And what's the age of the children? You know, is there a cutoff that once they become 18, you stop? Or
That's an awesome question. Actually, we watch children as young as 2 years old. So the camp goes from about 2 years old all the way to 18. So what happens is once they turn 18, they can return their service by becoming a mentor of the same camp. So how it goes is our mentees, our surviving children, they wear red shirts. Our mentors, we wear blue shirts. So when you have a mentee who becomes a mentor after they turn 18, we give them a purple shirt. And that lets the rest of the camp knows that not only have they gone through their own grief and loss, but they're also giving back to someone else to help them go through theirs. So it's really an amazing and powerful program. And some of the kids, you know, I said the camp is at the end of May. A lot of the kids that come, they miss their own graduation. So a part of the TAPS program is they do a huge graduation with pop and stamps and everything. They get diplomas, and it's magic. It's absolutely magic.
And besides the kids that become, you know, the 18-year-olds that can become mentors, what further support do you give them moving forward as far as giving the tools necessary to become a productive member of society as far as helping them, direct them toward their education or other, maybe business skills that you can give them, that they become, entrepreneurs that give back in other ways other than, serving the military?
Another great question. So when they do turn 18, they actually go through a part of training for education and for job training. And they get an education box. And in this box are tools for employment, if that's what they want to do, because we know everyone doesn't want to go to school. But they get a scholarship and they have different grant opportunities. So they get a whole box that is fueled just for their furthering education and becoming of adults. So we don't leave them. Also, we extend consistent support. There's regional camps that happen throughout the year all over the United States. So, and they always have us. We do exchange information if it's okay with the parents at the end of camp to stay in touch. And we also encourage the children in the different groups to stay in touch as well. And we check in, and they always have, different support numbers that they can call. TAPS actually has a magazine as well. So, there's always different articles to support throughout the year. They do a magazine once a month. So in those magazines are support articles from people that they've met, people that they may know, people who've gone through similar things. And it also always has the next camps for the following year.
Do they ever feature, I wouldn't say a case study, but success stories of, what they're doing now, some of the graduates, and feature them? And also, the second part of the question is there kind of a resource for them? Say one of them wanted to become an MRI technologist. Would they know to reach out to you? Is there some kind of central, registry of all the skill sets of all the mentors that they can reach out, almost on a one-on-one consultation or tutoring or mastermind, if you will?
That's another great one. I never thought of that, but that is definitely something that I could take to the team. I don't believe that they have a centralized way. And that may be part and due to the fact that people come from everywhere. The camp has gotten so big to where in a year, we've had 560 mentors come and support 550 children. So to put it all in one place where it's easily accessible, I'm not sure if anyone really thought of that yet, but it actually is a great opportunity for children to be able to one-on-one hand pick what they want to do and talk to people who they know that are already ready to support them. So that really is something great to me.
They talk about, accountability partner. So that there's ways that all the resources, untapped resources, there's relationship capital that's collecting dust that I think, would offer so much more, insight, direction, motivation.
Yes, sir.
Because what you want is, you're here, you become a new hero, allow the kids to shine and have their, hero arc, come to a good place. And sometimes you just need the right person to give them a boot in the rear end or encouragement. And, they know that they're not alone, that someone's already traveled this path. Yeah. And, if they want to create their own path, fine, but at least they'll have, at least they know to go north instead of south. But yeah, I think that's something you should bring up to the powers that be, and besides featuring the kid, also feature one of the mentors, and have a bio that each of the mentor can supply information, and have a central registry where the kids can reach out and tap the knowledge and the skills that have already these mentors have accrued.
Mm-hmm. That's an excellent idea, and I'm taking my notes. I'll definitely bring that to the team.
And so, you've been with us 3 years.
We're closer to 3 than 2.
So what has been the greatest reward and greatest disappointment working here?
So the greatest reward is that every day I get to come to work and be my true self. And my true self gets to help people get through things that some people aren't understanding of. I've actually met a lot of people who don't understand claustrophobia. And I honestly didn't realize how, well, I'll get into that with my disappointment. It's just a pleasure for me to guide people through something that is rough for them that other people don't understand. The disappointment is the fact that I didn't realize until I started working more integratedly in the medical field that people in the medical field aren't always kind. And to me, I don't understand that you have someone coming to you with a problem that they don't understand, in pain, uncomfortable, possibly scared and nervous because they're unaware of what's going to happen. And then they're met by people who are, rushy or pushy or, not professional or not kind. So I get to, kindly help people, and it makes the biggest difference. When I just believe kindness allows people to be comfortable, and it allows people to listen better, and it's a better situation for me and the patient. So being here has been an absolute honor to me. So my favorite, we have a wonderful staff here. We work together very well here, and it's a family. So that's probably my biggest reward. Because one thing in the military, you have a family always. That it doesn't matter where you go. It doesn't matter if you get out. You always have family. And I feel the same way about here. So it ties the two for me. So I get to be happy every day coming to work.
No, that's great. And you brought up claustrophobia. It's because of the upright MRI, the Fonar upright. 25% of our patients are claustrophobic or have failed other centers. And, when we ask them if they're claustrophobic, about 40% say they're either anxious or claustrophobic. So,
Yes, sir.
We just are about to publish our own 15 commandments of how we treat all patients, but specifically, especially claustrophobic, because, we greet everybody with a smile, treat everybody with respect and dignity, don't rush them through the study. They're in complete control. They can, stop the exam at any time. If they want, they can bring a member of their family inside the MRI suite. There's constant communication between the technologist and the patient. And, we listen first to find out what's going on, what their concerns are. And I, look forward to even being better and enabling to serve those patients, because they really can't go anywhere else. They don't want to go in the coffin, the closed unit. And here most of them sit down and watch TV.
Yes.
And other than the noise that the machine makes in between the sequences,
right.
They're just watching TV. So it's a nice environment for them to feel safe in.
Can I give you a couple of my golden rules of dealing with patients?
I'm sorry? Go ahead.
Can I give you a couple of my golden rules when I deal with my patients?
Go ahead.
So my golden rules are: one, always greet the patient with a smile. And I always try to build rapport really quickly to make them as comfortable as possible as soon as possible. Because we all know once you're comfortable and you feel safe, that the anxiety kind of subsides. For me, I actually feel like about 70% of my patients a day are claustrophobic. So it's very important to build rapport, make them comfortable, and I do that as immediately as possible. And I let them take their time. And I treat each patient individually. It's never a blanket system. Some people are more claustrophobic than others. Some people cry, some people are more nervous. So I feel like if you pick up on their energy first and you let them, read yours, and it's good energy, it helps them to just calm down. So I've done breathing exercises with my patients. I've gone in and held their hand while they cried. I've, stood there for a few minutes. And I definitely make sure the most important is to be in communication. I feel like when patients have as much information about their exam, they're more comfortable. So I try to do those things efficiently and very quick with each patient so that we have a high success rate of getting them through their exam.
Well, one thing you do great is laugh.
Thank you.
And they found that laughter is actually a good remedy for claustrophobia because it reduces the anxiety. It just helps, and they say laughter is the best medicine. Well, claustrophobic is definitely one of the best medicines. And the other thing we're going to do even more is celebrate their victory. I survived my MRI at DMI. and one of the ideas, we're going to have stress balls printed up where, they leave to get a stress ball. So next time that they're anxious, two things. One, they'll remove their anxiety, plus we'll brand our DMI because of the wall.
I'm 100% behind it.
No, it's great, and it took us a while to realize that claustrophobia. Again, it's an area that most imaging centers deal with, but they don't make it top of mind.
Right.
And because of the Fonar unit and the open architecture, we're able to get most of the patients, through the study. Yeah. Not all, some are just can't. But we have a pretty good success rate. And they say if you can't fix it, feature it. And one of the things we're going to do is feature the fact that we are the leading experts in dealing with claustrophobic patients that need an MRI. So let's see, what else can we talk about? What do you think of Dr. Brownstein?
I think Dr. Brownstein's a good guy. I think his heart is always in the right place. And he's funny guy. Very personable. Actually, to be very honest, for a radiologist, you're more personable than I thought you would. I've encountered several radiologists who love a dark room and no people. So to see you pop out and say good morning and speak to the patients, it's actually very rewarding to see it. So thank you for that.
Well, you're the best.
Well, thank you, sir.
So I'll give you a good recommendation now. You don't need me to write it. Everybody knows. So in closing, first of all, again, I want to thank you for your service. Thank you for helping the kids that have lost their parents. And if I can help you with the ideas that we talked about, I'd be more than happy to. It's my way of giving back, for you giving to us. And I'm really proud and happy that you're with us.
It's my absolute pleasure, sir. I feel like this is my home, and I would love to stay as long as you guys will have. It's a wonderful partnership for me. So I greatly appreciate the opportunity in taking me on, because I came on as a student. When I joined the team here, I was hired on as an X-ray tech because of my military service, but I appreciate the opportunity you guys allowed me to train as I was in school. And I was, you guys showed me the Fonar machine. I was unaware that there was even this type of capability to do MRIs. So you guys were, actual blessing to me as well, as far as, extending my knowledge field of MRI. So thank you.
You're quite welcome. Well, I'll see you in about 5 minutes when we do the next patient. Bye.
All right, have a good one.
Thanks for tuning in to the Dynamic Radiologist Podcast. Make sure to click subscribe to get updates on our latest episodes.